And you're welcome back. It's still Breakfast Extra here on News Central Television. It's time for us to switch gears. We begin our last hour of the show this morning on wellness. It's time for Wellness Central. It's where we spotlight on the health issues that matter most to Nigerians. Now, last month, October, we celebrated Breast Cancer Awareness Month. It's a month that is set aside to raise awareness about breast cancer, and where we realized that there is a growing concern about the rising number of cases in Nigeria. Now, despite more awareness campaigns and screenings, late detection, as well as poor access to care and the high cost of treatment continue to drive mortality rates, especially among women in low-income communities.
So to help us unpack why survival rates remain low and what can be done differently, we have Dr. Owen Omo-Ojo, a public health expert, join us this morning. Good morning, Doctor, and thank you so much for being here.
Good morning.
And also the future Minister of Health.
On health, yeah.
And Women
Affairs. It meant that. A big
Doctor, you're welcome.
Thank you. Good morning. Thank you for having me.
Yeah, looking at the big picture, I mean, why is breast cancer still claiming so many lives? I mean, over the years, this is not the first time, not the second time. We've had campaigns over the years, but the situation is still there, staring us in the face. Why?
So we're talking about the Nigerian context.
Yeah.
And so breast cancer continues to claim more lives every year. About half of the cases of breast cancer end up in death, right? So that's how stark the statistics are. And the simple one-line answer to that would be late detection. Late detection, and that is why a lot of campaigns around breast cancer focus on awareness and early detection. Most cases, and let me just state that the data on breast cancer is still quite sparse, right? So the reporting, the incidence rates of breast cancer is quite sparse. However, with the data that we do have around incidence, there is a clear pattern of late presentation. So most cases of breast cancer present in the late stages, so stage 3 and stage 4. And at that stage, that is where it is, the treatment options are limited. It is more difficult to manage in that situation. And that is why the five-year survival rate in Nigeria is anywhere between 30 to 40%, right? So at least 26 to 27 of women, 26 to 27 out of 100,000 women that are diagnosed with breast cancer will die. So at the crux of it is late detection, because women are presenting later in late stages, stage 3 and stage 4. And so when you compare the statistics with those of developed countries, you'd see that the survival rate is anywhere between, the 5-year survival rate is anywhere between 70 to 80%, because women are presenting early in stage 1, stage 2, and they have access to more affordable healthcare that will allow them to have the proper diagnosis and the proper treatment as well. Again, we simply do not have enough treatment centers for breast cancer. Whilst we have, so Nigeria has the National Cancer Health Fund, right? It is a government initiative that is co-funded by Federal Ministry of Health, the National Cancer Research Institute, and private partners as well. And the National Cancer Health Fund is supposed to help patients with breast cancer, cervical cancer, and prostate cancer, which are some of the most common cancers in Nigeria, patients to get treatment for up to 2 million naira. But again, it is not well funded still, because there are not a lot of private partners that are involved in this process. And we know the Nigerian situation, so it's almost like every government initiative, right? We always have an issue with implementation. So So yes, there's a website. Yes, there's information access and all of that, but it is not well utilized. Again, even with that fund, we still have more people. The mainstay of healthcare expenditure is out-of-pocket expenditure, which I dare say is catastrophic. And so when a woman has to make a choice between catering to her basic survival needs, food, shelter, and paying to go get screened for breast cancer, you bet she's going to cater to her basic survival needs, right? So we don't have enough people in the health insurance net. And so women are prioritizing other basic needs rather than this. And so they are not getting screened, they're not, Right. And then again, finally, we don't have enough, diagnostic centers that are spread across underserved populations or underserved communities. And for a country of over 200 million people, we only have about 10 specialist radiation therapy centers, right? And that is wildly inadequate to serve the population. If we're getting about 32,000 cases of breast cancer annually, and we only have about 10 to serve this population, it is wildly, insufficient. And so these are some of the issues that I believe contribute to the high mortality rate.
What about the cultural aspect as well? What about norms, cultural norms and beliefs that have continued to, widen the barrier between, women going in for early detection and, treatment?
Absolutely. So that speaks to the lack of awareness, which is what a lot of private institutions and organizations like the organization that I run, HIJC Health Consultants, and a lot of banks, and private organizations that do breast cancer awareness campaigns. One of the things that we focus on is debunking those myths, right? That breast cancer is not a curse, it's not a spiritual attack, things like that. So there are those cultural myths around breast cancer that inhibits people from going to get tested and all of that. So yes, absolutely, it definitely plays a role. And that is why taking it further in terms of awareness, can we take breast cancer awareness down to the grassroots, to primary health care, tying in community health extension workers who are the closest health workers to the people at the grassroots, right? So when I say taking it down to them, it's empowering the community health extension workers, upskilling them, training them and teaching them, sort of making them cancer champions, cancer awareness champions, or in this case, breast cancer awareness champions, right? And also teaching them how to do breast examination and teach self-breast examination as well. So at the primary healthcare level, doing that, and then also including breast cancer screening as part of the National Health Insurance Authority plans, right? Even though we still have less than 10% of people, 10% of Nigerians under health insurance coverage, I think a step in the right direction would be to actually include breast cancer screening as part of the plan benefits under the National Health Insurance Authority plans, which then cascades to the state health insurance plans. And now our public health professionals in Nigeria are even now advocating for that to transcend to the local government level, because the local government is the closest to the people. And with the local government financial autonomy now, they're able to key into health insurance, and being that they're closest to the people, they know the psychology of the people that they serve, and so they're able to get more people into that net. Because listen, if we continue in this trend of out-of-pocket expenditure, I'm sorry, we're not going to get very far. People are always going to prioritize basic survival needs over healthcare.
Especially with the public health centers that are scattered across the different local government areas. I think about 774. Hence why I said she's a future minister of health. I told you.
Well, tell us about the age bracket. Is there an age bracket that's more prone to, suffering from breast cancer?
Well, in terms of risk factors, yes, being over the age of 40 predisposes women to having developing breast cancer, but there are other risk factors. For example, having the BRCA1 and BRCA2, so BRCA breast cancer gene mutations, being of African descent, believe it or not. And I say that because African women have denser breast tissue. And so when you have denser breast tissue, that also predisposes. It's a known, or it's a studied risk factor. And of course, there are other risk factors: not having born a child, or carried a pregnancy, or not had childbirth, early menarche, late menopause, so early menarche, starting girls that start their period before the age of 12. And late menopause, women who have menopause after the age of 55 years as well, that predisposes them. And then, of course, lifestyle changes, obese, excess alcohol consumption, being exposed to harmful chemicals, which that also puts women at risk. And because we're speaking in the Nigerian context, women of Africa, I know that we advocate for women above the age of 40 to get mammogram annually, but we also know that mammogram is expensive. And since African women have more dense tissue, we have now started to advocate for women above the age of 40, or women who have a positive family history, because it is tied to family history as well. If you've had a like mom or grandmother in your family has had breast cancer in the past, and for those women, we advocate that earlier, maybe from the age of 30 upwards, they get a breast ultrasound scan at least once a year. Breast ultrasound, of course, is more affordable. It exposes you to no radiation, and it is actually able to detect breast tumors better than mammogram for dense breast tissue, right? So it is advisable for Nigerian men to get a breast ultrasound scan. But beyond that, self-breast examination, which is one of the things that we advocated for when we had our breast cancer awareness program, HIGC, last 2 weeks. That's one of the things that, we taught the women who participated: self-breast examination, and then again, going for screening. And one of the first things in screening is getting your breast examined by a health professional. So yeah, those are.
Are there preventative measures or preventative tactics that a woman might take, before just early detection or yearly screening? Just because I know about there are issues of hereditary as well that can play into it. There are persons who believe that when you breastfeed, you can get breast cancer. It's endless. So help us demystify all of that.
Well, so the only way to prevent breast cancer is to have a complete double mastectomy, so take out your breast complete. That's the only way to prevent it.
See?
That's the only way that you can prevent breast cancer. And even at that, if it's not done by a skilled surgeon where they leave some residual, breast tissue, you could still, so really there's really no way to prevent breast cancer. It is still about awareness and understanding what the risk factors are, which I have already talked about. And when you know that somebody from your family, has had breast cancer, that puts you at risk, and so you're more conscious about this thing. So again, it goes back to awareness and self-breast examination, knowing what to look out for. If you develop a lump, or if you see that your nipples are inverted, or there's something called peau d'orange, so which is orange peel. So when you see that your breast has like an orange peel, and I mean, it's not just for the ladies. Sure,
men as well.
You made it sound like peau d'orange is something quite luxurious.
Because because it's in French. Yes, yeah, language sounds.
Peau d'orange.
Yeah.
Say it.
Peau d'orange.
Say it, Judith.
Coup d'orange.
Peau.
Oh, peau d'orange.
d'orange.
Ah, so peau d'orange, skin of an orange.
Yeah,
Ah, gotcha. Okay, it took me long enough.
So orange peel. And so if you notice that on your babe, right? Like you notice that your babe's breasts, and I'm saying this for the men as well, because sometimes it's the partner who actually notices that, you know, there is a change in the, you know,
texture.
breast, in the texture. So most people would, the first thing that will be a telltale sign first would be a lump that they discover, right? And a lot of times it actually happens where it's the partner that discovers it. Of course, pain in the breast, discharge when you're not breastfeeding, you start having milky discharge. Of course, that could be a sign of other things, but it's also a major sign of breast cancer discharge, whether it's milky discharge or bloody discharge. Those are some of the things that you want to be looking out for.
What about age?
Yeah,
age as well,
so being above the age of 40 is also one of the things that could, you know, one of the risk factors.
So the older you get, hi, women. It's always something, isn't it?
Yeah. But I hear from men too, but numbers is a little, right? So should men be checking, or we should just forget about it?
So the incidence in men is just about 1% of cases. So I think men have a lot more things to worry about, like prostate cancer, colorectal cancer, and things like that. But yes, there is the risk as well. So you can, you know, self-examine your breast. But yeah.
All right. Let's quickly go on a short break, shall we? When we return, we're going to be talking about advances and just solutions, especially both at the local government level as well as ourselves. After the break, stay with us. And you're welcome back here for our Wellness Center. With us is Dr. Owen Omo-Ojo. She is a public health expert and also the future Minister of Health and Women Affairs in Nigeria. Now, we were talking about breast cancer awareness, as October was Breast Cancer Awareness Month. Now, we've been talking about risk factors, we were talking about age, we were talking about why the numbers keep increasing and why more women are dying in spite of efforts when it comes to raising awareness about the disease. But before we round up this hour, I would like to have the final remarks on solutions, both at government level, state, local level, as well as private individuals as well. Doctor, how can we, bring the numbers down? What more can we do? Is this economy? Is it health plans? Is it, what are the, I feel like it's a concoction of a number of things to make it work, Doctor.
Absolutely. Well, first of all, thanks to News Central TV for doing this, because this is a step in the right direction. Awareness, we're creating awareness. We need to then take this down to the grassroots level, take it in languages and through mediums that they can key into and buy into this, right? Languages and platforms that can reach them. So awareness, very important. And on the awareness side, I would say collaboration, multi-stakeholder collaboration. I feel like we keep doing things in like fragmented ways, right? So you have Bank A doing their breast cancer awareness work. But who is monitoring? How are we monitoring the progress and the gains that we're making, right? And so collaboration between public health institutions, like of course the one that I run, and I'm not even trying to market HIGC.
Too late. But will you send an invoice? Too late. We're sending an invoice.
No, but collaboration between public health institutions and private organizations, just so that we're able to have maybe like a breast cancer dashboard where we're monitoring the progress that we're making with the awareness campaigns. On the government side, I would say One, again, I already talked about it, including breast cancer screening and treatment as part of the planned benefits for NHIA, extending that, cascading that to the state level and local government level as well, upskilling the community health extension workers and making it part of the primary health care plans. We keep talking about tax net, bringing people into the tax net. How about we talk about bringing people into the health insurance net, right, so that they can benefit from this. Again, the National Cancer Health Fund, again, strengthening it to ensure that it is more accessible to more people. And then again, increased awareness, increase public-private partnerships, again, to increase the number of oncology centers and treatment centers as well. So public-private partnerships, because we know that governments cannot do it alone, and a lot more, but I know that we're pressed for time. But you're
an expert in this. Doctor, thank you. We appreciate you for coming on. Dr. Owen Omo-Ojo, a public health expert, giving us a bit of insight, as last month was Breast Cancer Awareness Month. It doesn't mean it stops there. It means that we must continue as individuals, private entities, as well as corporations, to continue, and also government to continue to sound the alarm and raise awareness about breast cancer.